Here we are, episode 2 with the Wellbeing Check-In. I am here with our CEO, Dr. Adam Curwood. How are you, Adam?
Yeah, good, thanks, Zach. Thanks for inviting me along.
Oh, it's a pleasure. So today we're going to talk about headaches, and that's a very common topic of conversation and a common condition that we see as chiropractors. And I just wanted to start off with, in your experience, Adam, how did you find dealing with headaches as a practitioner?
Yeah, I think even taking a step backwards is some people don't know that chiropractors can help with certain types of headaches.
Right.
And, sometimes you're going through the history, you're doing an assessment, and, you might even palpate or touch the top of somebody's neck or middle part of their neck.
Mm-hmm.
And you tell them, like, hey, did you know, you can get headaches from your neck? And they're like, what?
Right. Yeah.
So, yeah, I think seeing a lot of people over the years, we do help people with headaches, certain type of headaches. And yeah, I guess I've had some really good success, and yeah, that's what I've really found. What about yourself?
Yeah, well, interesting you say that, because what actually drew me to chiropractic first as a patient was my own experience with migraines.
Yeah.
So most patients who I've seen and who go through these conditions, I've discussed this with. And, pretty much, the short form of it is I was having these migraines as a kid, probably around 10 to 12 years old, and tried everyone, saw every practitioner under the sun. Nothing was really helping, and then I got referred to see a chiropractor, which I hadn't heard of before. And I went and saw them. They explained to me from a holistic perspective, I guess you could say, multiple factors that were creating this symptom, which was a migraine and the pain. And they talked primarily about how the dysfunction in my neck was creating these symptoms, irritating the nerves, lack of movement through the actual vertebrae themselves. And as a result, that pain referred from the neck up into, behind my left eye for me personally. And I was going through this for months, and it was just something that I was really struggling with. Some days I couldn't even go to school. I'd sit in a dark room and just curl up and cover my eyes. And once I started to get the ball rolling with this chiropractor, they, transformed my life essentially. So much so that when it was time to come to making a decision about VCE choices and all that, I was like, chiropractor is the one. Like, if I can get a result like that, I'd love to be able to help other people with that too.
Awesome.
So yeah, it's a condition that whenever I have a patient come in, it's kind of close to my heart, and I really want to be able to serve them the way that I was able to be on the receiving end of great chiropractic care myself. So yeah, that's kind of like a introduction to chiropractic, and also something that, like you said, most people don't realize chiropractors can help with.
Yeah, and I think a lot of people kind of understand things like sciatica or like, a pinched nerve and how it can maybe be irritated in your neck and then kind of refer down to your shoulder or arm.
Right.
Or, low back issues or sciatica where there's an irritated disc or it's irritating the nerve and then going down your leg.
Yeah.
But I think some people either aren't aware or, haven't been told that the nerves in your neck, yes, they go down to your shoulder and your arms and local to that area, but then they also go up. And that's sometimes what people forget about or aren't aware of. And yeah, we see a lot of people with cervicogenic headaches or tension type headaches. And yeah, some people get some really quick relief with some type of chiropractic care.
Yeah.
Other people do take time, especially if it's more like, postural related, which I'm sure you've found as well.
Yeah, absolutely. So one of the main contributing factors for me was I had two pretty, average pillows, and I would stack them up against each other. So instead of me sitting in a neutral position with my neck when I'm laying asleep for 6 to 8 hours, it was actually propping my head up and having it in this flex position. So night in, night out, I, without really knowing, I was actually exacerbating this condition more and more and more. So again, the chiropractor was able to give me a pillow assessment. They asked me to bring the pillows, and they checked it out, and then they go, all right, well, this is part of the reason as to why you're feeling what you're feeling. And then they recommended me a pillow that they had in their clinic, and made a huge, huge difference in combination with the adjustments. And that's something that we do here as well.
Yeah.
And I tried my best to help our patients identify contributing factors like the pillow, and more often than not, you'd be surprised how many people have these pillows that they bought 10 plus years ago.
Yeah, we've seen that before.
Yeah, and some pillows are great quality, others are less. So it's about being able to distinguish which one is which, not just throw out every pillow and just have a new one. So that's why it's important to see how they sleep, what their position is, and educating them as to what is the best possible pillow and best possible way for them to sleep. So you mentioned cervicogenic and tension type headaches.
Yeah.
Now, the average person wouldn't typically know what they are or how to distinguish those. How would you describe them?
Just before I do that, can I go back and talk to you about pillows just quickly?
Yeah.
So the thing that I talk to people about is it's kind of like a shoe in some way. And yes, we don't necessarily have as many pillows as we do shoes. But what you need to remember is that they do have a lifetime. They last for a certain period of time. And I think as you said as well, yes, it can be the quality, but it can also be the fit that you get.
Yeah, right.
You can get a really high quality shoe, but if it doesn't fit your foot or your foot shape's different, just like your neck curve or the way you sleep on your shoulder, it's not always going to work for that person. So getting that assessment can be really useful, or if you've got something that is working, continue to use that as well.
Yeah, absolutely.
Talking about headaches, and I'm glad you brought that up, because I was actually going to say, what are some of the symptoms that people are thinking about that they're like, oh, maybe a chiropractor could help with this? So as we're talking about cervicogenic headaches and then tension headaches, they're like the main two ones we help with. So tension headaches sometimes can be like a bit of pressure at the base of the skull, especially. So there's those nerves that come up through your neck and essentially innervate those areas. So it might feel like the base of your skull. Sometimes that might just feel tight or tense. Other times it can get some weird type of symptoms like light tingling or pressure.
Right. Yeah.
And then tension type headaches, they can be there, but then they can also wrap around the sides. And I feel like I speak to people and I say it's like a band almost across their forehead. And that band feeling, as soon as they use that word, or if I ask them that word, they're like, yes, that's it. That's a really key indicator for tension type headaches especially.
Yeah.
And so cervicogenic headaches, what that really means is that the origin of the headache is coming from your neck. Okay. Forget my anatomy, but I think it's from C2 basically down to C5. I think they can be those referral patterns. Right. So cervicogenic, meaning basically coming from the neck, is essentially what it's meaning there.
Makes sense.
Yeah.
And in my experience, what type of people that mostly experience these type of headaches is, and correct me if I'm wrong, is people who typically sit at a desk or who work in an office with a computer and phone calls. And we like to explain in a way where your head is essentially a bowling ball on a stick, right? Yeah. And the further that bowling ball moves forward in front of the shoulders, for example, it's going to feel a lot heavier on your neck. And as a result, like you mentioned, we're going to have tightening of the muscles and obviously restriction of the joints themselves. And as that begins to happen, that typically will create nerve irritation. And that nerve irritation will progressively build and build and build until it starts to become a symptom. Now, a lot of these presentations can be caught before they become symptomatic, of course, but most people will typically not wait, but they will realize something is wrong once that red flag, that symptom has ticked off, and they've gone, okay, I've got this issue. Who can I see that will help with this condition? And most people, Panadol and Nurofen is the first go-to, which they're great in their context, but it's not a fix, right? It's more sort of a muting of symptoms.
And I think you said before, like it can build up and the like. And with a lot of headaches that I've seen over the years, is there's normally like a pattern to it. Yeah. And the big reason people get confused or annoyed, or they're just like, I don't know what's going on, is it might build up. They might not feel it for the first part of the day, for instance, and then they might start to get that headache consistently from 3 to 5 o'clock.
Yeah.
And they go home and they move around and all those types of things, and then it might reduce, or it might just even be there for the rest of the day. Yeah. They go back to sleep, they wake up again, and they're like, oh, it's gone now. Or I'm guessing for you with when you had your headaches and it was attributed to sleeping, I'm assuming it was like worse first thing in the morning because you'd had it, you've had that stress overnight, and maybe if you got through the day, it might have started to move and free up a bit, maybe less irritation there. Yeah. But I think a lot of the time there's a pattern to these things, and also, when speaking to people, what I found is that they might get a little bit confused. They're like, well, hey, the headache comes and goes. It's not really that much of an issue. And that's when I speak to them about, well, hey, it's not that it's necessarily symptomatic or the pain is there all the time or the symptom is there all the time. But what you'll normally find through the examination is there is that tightness or hypertonicity of muscles. There are those joint restrictions or subluxations. There are areas of inflammation or edema, which is basically the tipping point before those symptoms start to come on.
Yeah, exactly right.
And I know as chiropractors, we see that stuff and, you know, we're like, hey, let's work on this. Just as a GP might look at your high blood pressure and be like, hey, you're not feeling a symptom, but let's work on this now.
Yeah,
or
absolutely.
you've got a high blood test in a certain area, let's work on it before you start to get symptoms. So, you know, for headaches especially, it's one of those things that we can see the precursors, or it's there and the symptoms are coming and going, or they can even be constant in some cases, which, you know, it's a hard life to live if you just got constant headaches every single day, as you were telling us.
I can attest to that. So, yeah, you're absolutely spot on with all that. And as far as, you know, why we are discussing headaches, and we've mentioned that chiropractors can help, some people, you know, may not still understand how we actually exactly do that. So, with your experience, break down how you would typically address someone's headache.
Yeah. So when most people come in, you know, we have a form that they fill out, and we want to find out, I guess, how their symptom, or in this case, their headache's affecting them.
Yep.
And then we essentially go through a case summary for those, you know, practitioners out there. You know, it's called you know, Lodza Trapper. That's what we learned at RMIT.
Yes, we did.
I think another one's like QRS. Oh, I can't remember what the other one is, but there's a few different ones. And basically, that's just a really detailed way to do a history. So that's point number one. And a lot of the time, probably 50% of the time, before we even put our hands on somebody, just listening to the history, if not more, we know what's going on.
Correct.
Cool. So that's the key number one. Number two is then definitely a palpation. So what palpation really means is feeling or touching the area. And that's when I was talking about, you know, edema or swelling. It could also mean, you know, joint restrictions or hypertonicity of muscles. So that's when we're more doing our assessment. Sometimes then we also move into orthopedic tests. So orthopedic tests are essentially medical orthopedic tests to clear out and make sure that it's safe to proceed with treatment.
Right.
Or it gives us an indicator as to what might be going on and how we might have to alter what we're doing. Also neurological testing, which can indicate, you know, sometimes what types of headaches they are. Also, if it might be something else that's going on. So whilst we want to find out exactly what's going on, we also want to know what it's not, because that helps us to determine what we need to do.
Yeah, spot on.
And then, based off what's kind of going on, if we think it's maybe more postural or structural related, or we want to make sure that we rule out things, we might take a set of x-rays.
Yeah.
And alongside of that, we normally take a posture photo, which helps us to get a bigger picture as to, is this more of a postural related issue or a chronic issue?
Right.
Or is it something that we need to refer out for? Is it a headache that's outside of our scope that we might need to say, hey, this needs medical intervention? Or is it something that we can deal with, which tension and cervicogenic headaches, I think we do an amazing job a lot of the time.
Yeah, 100% agreed. And you touched on a good point there. Sometimes that some of these conditions that can mimic headaches or feel similar to a tension type headache would be out of our scope based on, you know, orthopedic testing and examination. And I'll say that to patients, typically in their first appointment, where I'm explaining what spinal dysfunction is and how that creates nerve irritation, but there are also so many conditions that can create similar symptoms. So when we are in a chiropractic clinic, we're obviously going to assess it to the best of our ability, but also precursoring with, there may be some other conditions that can create similar symptoms. But when we're here, I'll explain it from a chiropractic point of view, and through that assessment, if we do believe that there is something else at hand, we will refer you off to, you know, whether it's a hospital, GP, or whoever it's the relevant practitioner at hand to help with that condition. Yeah. And then that obviously brings us to, if everything has been cleared, to the adjustments. So how would you explain how that works with someone's headaches?
And just on that point, you know, ruling out things and making sure that we are doing the right thing. I love it when a patient comes in and says, hey, aren't you just going to, do that adjustment just give me the crack?
Yeah.
And, as much as we'd love to, because that's a big part of what we enjoy doing.
Yes.
When you're looking at that, you've got to be like, hey, we want to make sure that you're in the right place. We want to make sure that we're doing, a real service for you. And we want to make sure what we're doing is safe as well.
Of course, yeah.
So, I love the keenness of some patients. Like, yeah, just put me on the table and crack it. I've watched all the videos. It's awesome. Or if somebody's seen a previous chiropractor or another previous medical profession, practitioner, and they come in, we want to double check and triple check things.
Yeah.
So coming back to the adjustment, and I guess what we're doing is what we're really trying to do from a spinal or from a subluxation or a dysfunction point of view, is our main focus is to restore movement. Okay, right. Or restore function. So when we're looking for areas of the spine, we're looking for that palpation or that motion palpation of where things aren't moving or aren't moving as well as they should.
Right.
Now again, we're doing a range of tests, but one of the final tests that we're doing is motion palpation, which is essentially, is that joint moving how we want it to or is it not?
Right.
Now, if joints, especially the spine, aren't moving how they are, that can cause nerve irritation. And what that's actually termed in, the medical field is disafferentation.
Right.
So all that's really meaning is that the messages through that nervous system isn't communicating as well as it should. Right. And sometimes, depending on if it's disafferentation or disefferentation, it basically means those messages aren't getting communicated back to the brain, or the messages that are going from the brain out aren't communicating as well as they should.
Right.
Now, sometimes that shows up as symptoms. Sometimes that shows up as the body not working as well as it should. So from a headaches point of view, that could be the fact that the nerves that are supplying those areas might be misinterpreting those messages, hence then causing headaches.
Makes sense. So that's a really great way of breaking it down with disafferentation and disefferentation. So the communication between brain and body. So the nervous system is almost like a highway of communication from the brain down the spinal cord, and obviously relays out through the nerves. And from what I'm gathering, the way that you're describing it is, if there's any kind of, we'll call them roadblocks along the way, which could be the subluxations, misalignments, whatever word you want to use, that's going to interfere with how that communication processes down from the brain to the affected area and back up again.
Yeah. And a way that you can describe it is almost like with a river. Like if a river's flowing really nicely, it's going in the right direction, it's going downstream, and then all of a sudden, let's just say, you chuck a heap of rocks in there, the water generally is still going to flow, but then you're going to start to create, these white caps or like the rapids where the water kind of gets a little bit mixed and messages, and it's harder for it to work. Right. So it's not necessarily that it gets stopped. It's not necessarily that it's chopped in half or anything like that, but it's just not flowing as well as it should. And that's a big part of, what we look for as chiropractors is how can the body work better than it currently is, or how can we remove that interference to assist with that? That's
a really interesting, I've never heard anyone describe it that way, with the river and the white caps. I like that, that's actually really cool.
You got to make up your own sometimes.
Yeah, sometimes it just makes sense and you say it out loud and you're like, I like that, really good. Awesome. So I guess the point of today's podcast is to essentially enlighten people about what creates headaches, but also to let them know that chiropractic is a form of treatment that can help with such conditions. Yeah. So I feel like the majority of people typically, we know about painkillers and anti-inflammatories and maybe even massage as well. But as far as from a neurological point of view and how that is interfered with by these misalignments in your neck, that can, as a result, create these symptoms up in our head and, essentially equal headaches.
Yeah, and I think I probably didn't answer the other question before, which is what do we do? We call them adjustments. Yeah. And for people who don't know what an adjustment is, so it can be basically any form of adjustment or treatment, essentially, that is aiming to restore movement.
Right.
Now, for some people, that's your traditional manual adjustment, or some people might refer to it as a manipulation.
Yeah, the cracking noise.
Yep.
Yeah.
So exactly, and normally when that's done in the neck, it's typically because it's closer to the because it's closer to the ears. It's normally a bit louder.
Right.
So people often go, "Oh, that was a bit louder than
Yes.
my mid back or low back," and you're like, "Well, that's because it's closer to your ears."
Yeah.
And that's something I always try to tell people before their first manual adjustment in their
Right.
neck. We also have activators, which some people prefer or some practitioners prefer, which is the clicky gun.
The little handheld instrument. Yeah.
Yep. And that's not always, you don't really feel a pop or a crack, but you might hear like a bit of a thud.
Yes.
Or like a clicky gun, I guess is what people,
Good way to
people refer
describe
to it. And then, there's other forms. So there might be more traditional mobilizations, again, which is just getting the joints to move, but you're not necessarily doing a quick push. And then I know there's a few chiropractors in our network that also do spinal decompression or traction therapy on the neck, which can sometimes help with headaches. And then also Atlas orthogonal, which I think Dr. Josh said he touched on last time.
Yes, we just had them last week, yeah.
Yeah.
So similar to an activator, but very different as far as the impulse that it is provided. It's a lot more gentler, and we're typically using that only for C1, also known as the Atlas, which is why it's called an Atlas orthogonal technique. So there's a variety of techniques, obviously, that can work for these headaches. It's typically, which one best resonates with yourself. There's no right or wrong, essentially, right?
Yeah, and sometimes it comes down to the patient's preference. Somebody comes in and says to me, "Hey, I've had the manual adjustment on my neck before, the cracking before. It works really well. We'll put them through the screening. If there's no contraindications, yes, we'll do that."
Yes.
If somebody comes in and says, "Hey, I don't like the cracking noise, especially in my neck. I'd prefer the clicky gun, or I've heard there's other options," we might use that. And myself, normally I guess 90-95% of the time I'll probably do more of a manual adjustment, so the cracking. But I've also had some amazing patients that I've seen over the years, and they just prefer the activator, or they just prefer traction on the neck. So there's really a few, there's different tools that we can use. Yes. And I think that's also part of the history, to find out what the person's looking for, what we also think is going to be best in their case, and then presenting that to them about what they want to do.
Yeah, and another reason as to why it's so good to have these multiple ways of adjusting is going back to what you said before about contraindications. I'm sure you experienced this, but there's nothing worse as a practitioner where someone comes in and they're just super, just crack my neck, mate. That's all good. I've seen chiropractors before. Just give me a crack. But meanwhile, you've read their intake form and it's got all these contraindications. Yeah. And you're like, all right, well, let's just go through and see what's appropriate, because the last time you did get adjusted was 15, 20 years ago. So it's great that you're enthusiastic, but maybe it's still best that we reevaluate and make sure we double check and triple check everything to see if you're still a candidate for these manual adjustments, or perhaps we've also got A, B, and C techniques which help with your condition as well.
Yeah, and we do, as I said before, we do have X-rays on site.
Yeah, which is amazing.
Which, as you said, I've picked up so many things over the years that if I'd, maybe just brushed to the side, I probably wouldn't picked up just through the history. Yeah. So it's a real, blessing to have that, to be able to double or triple check in some cases to make sure what we want to do with the patient is the right thing, and more importantly, pick up anything that we might alter what we do from a form of treatment or adjustment point of view. Yeah,
absolutely, because as good as a lot of our chiropractors are, at the end of the day, we don't have X-ray vision. We can't physically see under the skin. We can assess, we can mobilize, we can do all the double and triple checks, but having that X-ray on site for immediate access and viewing is, from my experience at least, just an amazing tool to have, especially with a diagnostic point of view, and ensuring that we can or cannot get you adjusted on your first visit. Yeah. So yeah, amazing. Dr. Adam, pleasure having you on.
Thanks, Zach. Appreciate it.
Take care.
Yeah.